With that, I present Dr. Eric Westman.
Thank you. It's a pleasure to be here. And my style is going to be just a little different. My talk today, Uncomplicated Keto. Do you really need organic grass-fed beef? And just to give you a little perspective of where I'm coming from, I've been at Duke for about 28 years, trained in clinical research, and was part of the early clinical trials that were addressing the safety and healthiness of a low-carb keto diet. And now that's going back 20 years ago when we first started to look at it. And we opened a clinical practice at Duke 12 years ago to implement what we had learned in the clinical trials. To try to scale up what we know, we have 2 new companies that we're launching, and I'm the past chairman of the board of the Obesity Medicine Association, which is the largest group of medical weight loss doctors, not the surgeons, medical weight loss doctors in the world. So there are a lot of different ways to go about weight loss and improving your health. We teach other doctors how to do that. At the OMA, or Obesity Medicine Association, we've been teaching the keto diet there for the last 10 years, basically. So going back to 1998, I started looking at keto, and my patients cued me in. 2 of my patients at the VA Medical Center in Durham were doing this wacko diet, steak and eggs, and one of them lost 50 pounds, and this was remarkable because no one really ever lost weight in my practice. I would send people, well, and it's not for me trying, I referred all my patients to the dietitians, and there were dietitians there, and the VA is very well funded in some areas, but it never seemed to work. So I followed that signal, and now looking back, we've published 46 peer-reviewed papers in good medical journals on the low-carb keto diet. And then the Atkins company asked Steve Finney, Jeff Volek, and I to rewrite or write the latest version of the Atkins book called The New Atkins for a New You. And then Jimmy Moore asked me to be the colored commentary for Keto Clarity and Cholesterol Clarity. And it's interesting because once you start writing books, then there's a presumption that you're just a book writer. And I remember meeting Dr. Atkins in 1998. He's one of my teachers, and everyone thought he was just a book writer making money off the books, and what he did didn't work. But I visited the clinic and actually saw that it was working, and I roped in Jackie Eberstein, who helped me to create HEALcare for Life and Heal Clinics, and she was working for Dr. Atkins back then, and she's still working with me now. So I've come a long way. In fact, my internal medicine is the best that I've ever been able to do. It's my first training is in internal medicine. It's just that I don't use medications. It's pretty amazing. So what does a clinical researcher and clinical guy do at a university like Duke? Well, my clinic is known as the clinic of last resort, meaning people have tried everything else and they're desperate. Sound familiar? People used to go to Dr. Atkins' clinic. I kind of saw that as a kind of going up to the top of the mountain to visit the guru, and what Dr. Atkins prescribed had to work. And so I carry that model where people come to me desperate for this to work the first time and every time. And so it's not monkeying, dilly-dallying around. This has got to work. So I've treated patients now not only with obesity and diabetes, but also PCOS, irritable bowel syndrome, fatty liver, GERD, heartburn, lymphedema, cardiovascular disease. The cardiologists who understand metabolic syndrome, which is the high triglyceride, low HDL in the blood, send me their patients. Cardiologists send patients to me, the ones that understand preventive cardiology today. In fact, the heart surgeons send me patients who are too large or have too many medical problems to do a transplant. So what they do is they put a heart pump in the chest that helps the blood flow around. These patients are probably the most sick people that are still alive and not in an intensive care unit, and I help them lose weight. So basically, I've created a obesity medicine clinic at a university, in a university setting, where we treat all sorts of internal medicine and even surgical problems. We help people with post-bariatric surgery weight regain. So no, surgery is not the total, final, permanent answer, and the harsh reality is that 30 to 50% of people who have had the bariatric surgery will regain almost all their weight over time if they don't address lifestyle. Even weight control, when medicines cause weight gain, we screen for medicines that are what we call weight positive, causing, and probably the sleeper that most people don't understand, and doctors out there use it all the time because it's so effective, are these intranasal steroid allergy sprays. They're very potent and actually can make people gain weight. Reminds me of a patient recently for whom the knee injection of cortisone was enough to stall the weight loss. And so just be mindful of medications that you're taking too. So at Duke, if you came to see me, we would do an initial evaluation, an hour-long teaching class, and then I would see you about every month to make sure that things were working well to your satisfaction. If you're on medications, I would teach you what to do with those medicines. And now it's about a 6 to 8 month waiting list, depending on the time of year, to see me at Duke University. So my mission now is to bring keto to the world, but I can only see so many people at Duke. So we started the company HEAL Clinics, HEALclinics.com, where you can go, and I'll talk a little more about that. And there was also a niche to provide truly low-carb, keto-friendly foods, and that's a company called Adapt Your Life. So after 20 years of clinical research and clinical care in a university setting, how do you help more people? This is one method that I'm working on, is to scale it up, to have it become available more widely. So HEALcare is the clinical company, and it's a guided keto path to healthy eating and living. There are two modes or methods. One is the non-medical weight loss. The other is the medical management. In the UK, these are being called de-prescribing clinics, where you get de-prescribed the drugs. So at HEALcare or HEAL Clinics, you get the dietary recommendations, which is basically a keto diet. You get the personalized guidance and support, and then there's medical supervision if needed. So I've developed a comfort level and knowing that there's been a lot of coaching from people, and there are a lot of great ways to do it. But if you don't have a medical issue, we can help you at a distance. Without that medical monitoring, we may ask you to get some blood tests done, that sort of thing. But if you have a medical problem, especially if you're on diabetes or high blood pressure medicines, we strongly believe that medical supervision is needed, and that's when you would have to see someone at a HEAL clinic. Think de-prescribing clinic. The Adapt Your Life keto products, you may have had a chance to sample them. There are cereals and bars and coffee shots, or collagen shots they're called now. Also with protein. It's just a source of nutrition that doesn't have sugar in it. And the keto bar is actually probably the most popular product so far at Adapt Your Life. Switching gears, and I'll come back full circle to what you can do and troubleshooting, those kinds of things. The harsh reality is that half of the U.S. is either obese or diabetic, or have diabetes, and it's getting worse. And as we heard today, and as outlined in two fantastic books, Good Calories, Bad Calories by Gary Taubes and The Big Fat Surprise by Nina Teicholz, this really all started when the low-fat guidelines were instituted, and it continues today. Sadly, in the medical world, doctors really are just taught about medications. So this is where you get into the treatment of diabetes. Diabetes is manageable. It's lifelong. It's incurable. All of these are words that are reassuring to you. Just get on this escalator of increasing weight and diabetes and more medications. It's really not a cure or a fix. But you can see here in the middle panel here, one of the guidelines in graphic form basically is medication. I mean, there's a lack of confidence in the doctor that what they tell you to do will work in terms of lifestyle change, because they don't know about lifestyle change that works. So that's the harsh reality. That may be why many of you are on medicines or had to come off the medicines, maybe even on your own. But that is one of the roles of the HEAL clinics or deprescribing clinics to get you off those medicines. So the current lifestyle recommendations, although as we've seen, they're changing slowly. There's an old saying that doctors practice the way they were taught in residency, meaning while current guidelines may be changing, your doctor may not change based on the current guidelines. You may have to inform them about the other lifestyle changes that can work, like the keto lifestyle. Let's see. So what's the solution, or what's one possible solution? The ketogenic lifestyle actually can put obesity and type 2 diabetes into remission. And the bottom line for the science is that when you eat carbs, your blood sugar goes up, your blood glucose. And that creates and here in the green line, when you don't eat carbs in a meal, your blood glucose doesn't go up. And that is now understood as the common mechanism between the road to diabetes. Diabetes is an elevated blood glucose, and the road to obesity, because that insulin rise after the blood sugar rise is what creates the situation in your body to create the fat storage. You don't have access to energy because you're storing the fat. You don't have access to the fat energy, so you get hungry again, and you repeat this cycle. It kind of mystified me why someone may be carrying around the equivalent of backpacks of food on their body, and they're not eating out of the backpack. That's basically the fat store, the fat energy. So what happens when you cut the carbohydrates out is your body burns what you eat. So if you're not eating carbohydrates, your body has to start burning fat. And so you start burning fat. The substitution of ketones for glucose is something we talk about a lot, and measuring ketones and all. But actually you're using ketones, but you're also using fat for energy. So it's not just the ketones you measure, it's fatty acids are going around and fueling your cells more so than the ketones. It's interesting to see this obsession about ketones when I wish we could measure the fat in your blood, although you measure the fat going down if you're losing weight by the weight going down. But there's no current measure of measuring the fat in the blood. Thus, we measure what you can measure, and that's ketones. Ketones are converted from your body fat into ketones, and that substitutes for glucose in most of your cells. Ketones that are not used for fuel are excreted by the kidneys, although it makes no sense if you're totally keto adapted to lose ketones in the urine because it's energy. So you may not show ketones in the urine after months or years of being keto adapted, shifting to fat burning, because you're actually using the ketones so much for energy. Thus, the urine strips might not show ketones, but the blood or the breath might. And also ketosis or nutritional ketosis is safe and desirable. The brain actually prefers ketones over glucose. The heart muscle prefers ketones over glucose. And babies are born in a state of ketosis. Pretty interesting, huh? I'm reminded of remember the palm olive commercial where Madge, you're soaking in palm olive? You know, you actually have ketones in your blood. Even when you eat carbs most of the day, you'll have some ketones. It's a natural thing. But now, try to simplify things or make things more less complicated. Not all low-carb diets are keto. And the simplest way to really define a ketogenic diet is by the number of total grams of carbohydrate in the food for the whole day. And you can actually pretty much be sure you're going to be in ketosis if you're at 0 grams of carbohydrates. If you go to 20 grams of carbohydrate, just about everyone will be in ketosis. And if you go to 50 grams of carbohydrate, total grams a day, maybe, depending on your metabolic state, maybe half of people will be in ketosis. So you could start at 50, measure ketones, and then find your threshold. Or if someone's coming to me to have something work the first time, they've come a long time, this is the clinic of last resort, I start people at the 20 grams of carbohydrate. And in my experience, people may be at 40, and I take them from 40 to 20, and it starts working. People might be doing 20 net carbs, and because the net carb calculation is really adding more total carbs, and it also allows for eating all sorts of different kinds of fake food products, I'll see people go from 20 net carbs to 20 total carbs, and it'll start working. So remember, that's my method. I want this to work the first time, every time. And keep it simple. So going keto is actually simple. You can have tasty, satiating, affordable foods, and it's also good for you. Here is one list of foods with basically you can have as much as you want of meat, poultry, seafood, and eggs. Of course, I know that you're not going to want much because your hunger goes away. Now that was the first kind of shock to the nutritional community. You're not even limiting calories and you expect people to lose weight. You're not even explicitly having people count calories. Yeah, it just works differently. Your hunger goes down, you eat less. And I would say that works about 95% of the time. Those 5% where it's not going to work immediately, you might be on medication, you might have other intervening things like, that 1 minute every night you have Oreo cookies, then you think but I'm doing it for every minute, every hour and minute of the day except that 1 minute without knowing that, those Oreo cookies would stop the fat burning. So just understanding how strict you have to be is a common mistake. This list of foods was actually designed, we don't really have a lot of people getting game foods in our area in North Carolina, nor do they eat oolakan fish. This was a list of foods that made it into the documentary My Big Fat Diet. Jay Wortman put a community on a low-carb keto diet in north of Vancouver, and it's a CBC, Canadian Broadcasting Company documentary you can watch. So you have a list of foods tailored to your area, and then you do have some salad greens and vegetables. Second most common mistake that I see is having too many vegetables and salad greens because people have been taught you can have as much of those as you want. But they do have carbohydrates. And so while there are great minerals and vitamins in these foods, you have to limit them if you're trying to stay a fat-burning machine or in ketosis, nutritional ketosis. And then you can have limited amounts of cheese, cream. Next mistake I see is that people don't realize that a zero-carb oil has calories in it. So while if you just watch this list of foods or read something, you might say, oh, it's 0 carbs, I can have as much as I want because it doesn't matter. Well, yes. So calories do matter, and the high-calorie items like creams and oils and mayonnaise and cheese are limited. So that might be a common mistake that you're doing. You have to limit those just because calories do matter, and the total amount of calories typically goes down, and that's why people lose weight compared to what they were eating before. Now, it may mean you have to relearn what you've been taught, and this is why I do an initial teaching and then have people come back to make sure that there may not be a need for a course correction. So when you're looking at a nutrition facts label, you really don't need to look at the calories. You don't need to look at the fats or the cholesterol. And what you want to focus on is the carbohydrates. When you're doing a total carbohydrate counting kind of diet, you just look at the number that comes after total carbohydrates or total carbs. G means grams, so that you would look at that as 37 carbs per serving. Because it has carbs, you look at the serving size, and I'll use for example, a cauliflower or broccoli nutrition facts to show that even the vegetables on the allowed food list do have some carbohydrates in them. So you're getting about 10 grams of carbohydrates from the vegetables in leafy greens when you're having 2 cups of leafy greens and 1 cup of a non-starchy veggie. And you could nutrition fact that at any browser and find that out for yourself, or you could just let us make it simple for you. So do calories matter or not? Yes, but you don't need to count them, because for almost everyone, a keto diet is a low-calorie diet. This was first published in probably the best journal article that I've seen on this is 2005, a paper by Gunther Boden, where people were put on a metabolic ward and everything they ate was monitored directly. And so it becomes basically a 1,200 to 1,500 calorie per day type of diet or eating nutritional plan. And so don't focus on the calories. There's no restriction on eating meats or eggs or fat, including saturated fats. It's healthy, filling, so you can have bacon. And in North Carolina, there's a fascination with these things called pork rinds. And then you might see them as chicharrones. Probably the best chicharrones I've ever had was in South America. It really was like pork belly. And so don't fear the fats. In my clinic, we have a sign that says a slice of bacon a day keeps the doctor away. I had to have that because a doctor told this patient to have an apple a day, and it destroyed his keto diet. That one apple, 20 carbs for a medium-sized apple. You don't have to eat the whole thing. Have you noticed in fine restaurants what they'll do is they'll give you a wafer-thin piece of an apple, and then a lot of fat with it. So you don't have to have the whole serving size or the whole apple, if you will. And then, of course, mayonnaise and different types of meats, and butter is fine. Eggs are great. Low carb does not mean no carb. There's a lot of probably needless worry about no carb, and it's fascinating to see the carnivore subgroup of low carb mount their evidence that actually, plants put bad stuff in leaves so mammals won't eat them. Thinking of actually as plant leaves being a defense mechanism for the plant, and yet we're told we have to have them, and it'll be interesting to see that line of research develop. Until the research is there, we follow the more consensus view that you do have an allowed or recommended amount of carbohydrate in the form of low starchy or non-starchy vegetables. And, the common ground for all of the different healthy eating patterns that I'm aware of really just takes away junk food, and then vegetables and eggs are the common ground for even vegetarian types of diets. They can be low carb too. If you're just stepping back, do I need this to do this with my family? Can I do it with my family? Yes, you can. Or public health wise, no, you can't do keto and everyone. Okay, well, so rule number 1 would be just no sugar. Please. No sugar in the drinks, no sugar in the foods, and you're going to have a huge effect if in the southern United States, they could, put a ban or tax on sweet tea. Sweet tea, that would really be a public health measure. I had a patient who came back and was drinking sweet tea, and I said, you can't have sweet tea. It has sugar in it. And she said, well, you didn't tell me I couldn't have sweet tea. And so in her mind, sweet tea wasn't under the category of sugary drinks. So that's one reason why we have people come back and making sure that however you interpret the information, that it's going to work. But sugar is really kind of the big elephant in the room, where if we reduce that, remember the blood sugar goes up after you drink or eat sugar. That creates the insulin rise to keep the blood sugar down, and that is what creates the fattening hormonal situation in the body. Now, what most people don't understand, even some of the pundits out in the world that grains, pasta, and starches get digested to sugar in our bodies very efficiently. And so it's really not different. When you're trying to do a keto diet, you have to consider the bread, the rice, the potatoes, pasta, and muffins as sugar. It looks different, but it will raise the blood sugar. If someone has a keto or a glucose monitor, then I'll ask people, if you really wonder, check your blood sugar an hour after you eat something, and you'll see if it has sugar in it. Fruits and nuts, as people say they're healthy, and still today people look at me like, but I was told fruit is good for you, and yeah, but not when you're trying to do a keto diet, because fruit is so sugary, and now they've been engineered for sweetness, and that's the sugar inside it. Nuts represent the classic trigger food, and if you remember back to that list of foods I showed you, there are no nuts on there, because just as a show of hands, how many of you, when you start eating nuts, can't stop eating them? Yeah, just about every hand goes up. I'm told that there's a former statesman who would count out 7 almonds every night and then eat them, and if you can do that and stay to that, that's great. I've been doing this about 20 years. It took me 10 years to give up jelly beans on Easter, and I still can't stop eating nuts. So I just avoid the unlimited amount, and so if something occurs remember, my clinic, I need to have it work the first time, every time, because people have come to me for it's the last resort. Then if half the people can't stop eating nuts, I won't let anyone have the nuts, just as a safety precaution. But if you can have it and it works for you, great. Is it okay to flavor water with pineapple slices? And this is a popular thing to do. So in my mind, I thought, maybe you have a little cube of pineapple, put it in there. This one patient came back, and I said, well, explain to me how you make the pineapple water. She said, well, I take the can of pineapple, open it up, pour it into the pitcher. I'm like, well, but with the sugary juice, oh yeah, the sugar. So everyone else was having it at the home, and the family really likes it. And so just the reminder that checking in with someone who can help you make sure that it's working and that the teaching was correct. I've been doing this in the clinical setting. We estimate now in a quality assurance, we're starting to open the clinic records and do some research there under IRB guidance and approval. We've treated about 5,000 people in the North Carolina area. Most of the people come from the area, not like Dr. Atkins' practice, where most people visited him in New York City. And so in our area, it's not always easy to get food of the highest quality. And while we do have farmers markets, most of my patients don't go there. And so I found that actually the top priority in terms of what about food quality, top priority is a nutritious, low-carb, high-fat diet, and without too much concern about the food quality. So can you have grass-fed beef? Yeah, it's great. Can you have grain-fed beef? Sure. Maybe it's not as good or optimally for overall health and your membrane function, but you can certainly lose weight by just eating at McDonald's, for example. Off the dollar menu, just don't eat the bun, don't have the fries. A lot of well-intentioned doctors will just say, well, to lose weight, just don't eat fast food. No, that's not a great piece of advice. But so eat low carb with the highest quality that you have access to you and that you can afford. So farmers markets would really certainly encourage that. No processed foods and deli meats are fine. Did anyone grow up with spam, eating spam? Yeah, not to call out any particular food, but canned meats, for some people, they love them. If you lived in the big island of Hawaii, you could get spam and eggs at McDonald's. It's so eaten there. Just don't get the hash browns, right? So this doesn't have to be difficult. I have people coming to me saying, but I just can't, I can't plan. And that's why it doesn't work. I just bite my tongue and listen to the story. You don't have to plan. Just don't eat carbs, okay? Artificial sweeteners, no artificial sweeteners, and this is one of those things that cries out for science. meaning in lots of different people across different diseases, and because I have a lot of people eating artificial sweeteners and drinking them, and they do fine in terms of weight loss, in terms of diabetes getting better, and then some people can't have them. And the people who can't have them are militant and try to tell all the people who can have them that they shouldn't have them because they can't have them. Have you noticed that? Sorry if you're one of those people who can't have them, but try to relish in altruistic feeling of goodness that other people can. Yeah, that's like trying to tell the wife that you take confidence and glory in your husband losing faster than you are. That's tough. Oh, not to call out any particular gender, but that's usually the way it works. Do you only have stevia? Well, you know, there's a kind of a argument out there that it's natural, so it must be better. And that, again, that's not really a scientific principle to use. It's more of a marketing thing. So the kinds of questions I get, well, no bread. What about whole grain bread? Again, in someone's mind, you might categorize no rice. What about brown rice? No, all rice. So what about potatoes? What about French fries? Well, no, those are made from potatoes. So if you haven't been trained with nutrition like a nutritionist or dietitian, your mind might not think of things in the same way that someone trained in nutrition thinks about it. So you can talk about no fruit, and that's probably even with drama, no fruit, because, what will I do without fruit? But we can help people with fruit-flavored things. So using artificial sweeteners as the sweetener, or non-sugar sweeteners, stevia. Salt and sodium, you don't have to worry about salt as much when you're doing a keto diet, because the lower insulin levels allows the kidneys to get rid of the salt to a greater degree. Now, but if you have high blood pressure and in the salt-sensitive kind of high blood pressure, I won't ask people to add salt. So that's just something, if you're in the medical clinic, you have to worry about. Vegetable oils and seed oils, we get into these kinds of interesting arguments, and all I can say is that there are a lot of people who eat vegetable and seed oils, and they can lose weight on a keto diet. Now, does it have an incremental benefit for health? I don't know. And I think that's something that needs to be studied in great detail. Alcoholic beverages, some people can drink and lose weight on a low-carb diet. Sorry if you can't. Relish in the fact that other people can. Alcohol actually has a lot of calories in them as well. Yeah, I used the C word. So even though it might look like it's zero carbs, and the internet says it has no carbs, people tell me, hard liquor, and they really can thwart weight loss and ketosis because of the calories. So my teaching tells me that alcohol is burned first, and then comes the carbohydrates, and then comes the fat. So if you want to be fat burning all the time, primarily, then keep the alcohol to a minimum. Sugar-free snacks could be candies, mints, gums, and bars, but one fellow, it wasn't working. I don't make people write down things at home. That's too much work for most of my patients, and if you want to do that, that's great, but he came back. I had him write out what he was eating, and it looked really low-carb, looked keto, but he wasn't losing weight. So sometimes I pull the old, sometimes you have to gain momentum, and, because I don't really know what's going on at home. He might not tell me everything. But he got up out of the chair. I heard this chick, 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 chick. It was those little candies in a box, the Tic Tacs, yeah. And you counted out how many on there, they actually do have carbs. And he was having about 40 carbs a day because he was having several boxes of Tic Tacs. So these little things can add up, although most people can have those things in small amounts. What about fasting? Well, the consensus world is waiting for high-level journal studies to show the metabolic effects. Certainly fasting, if it means you're not hungry and you're eating once a day on a keto diet and you call it fasting, I think that's fantastic. So you don't have to eat 3 meals a day. And I don't use the therapeutic fasting in my practice, although a lot of my patients will do it on their own, and it seems to clearly work. We're in the medical world waiting for is the safety threshold, or even the metabolic effects in terms of body composition. You can lose weight by getting bariatric surgery, but the downside is that you lose lean body mass. So it's not the optimal way to lose weight from a medical weight loss perspective. So is it going to be as good as a keto with protein every day in terms of body composition, the fasting idea? We don't know. And that's why you'll see this kind of yammering among the children here. No, you shouldn't, or you should. And I think it's okay to eat less as long as you're not hungry. That's my take on the fasting. Do you have to exercise to lose weight? No, but you should stay active any way you like. I have people who come to me in wheelchairs. They lose weight. Diet is really 100% all you need, a keto diet. And that probably is the most shocking thing I ever say to people, because even some people will tell me, I had knee pain and I couldn't exercise, so I didn't even try to lose weight, because I know you have to exercise to lose weight. No, you don't have to. And not that you just shouldn't exercise. That gets misconstrued. Well, yeah, you don't have to exercise, but you can. And even there's a whole nother hours of lectures on how elite athletes are eating fat as fuel and actually winning races in record time. So, but I haven't had anyone yet in my clinic who's run a marathon, by the way. But certainly, if you're getting information on the internet, there are a lot of people who do that. So I really don't focus on exercise at first. I'll say when your body tells you to start exercising, that's when we'll start working in that direction. So you don't need food dietaries, don't need to track macronutrients. If you're under the 20 total grams, you're probably going to be in ketosis. So you don't have to check ketones. You don't have to check glucose unless you're on medication for diabetes and we're taking you off in a kind of de-prescribing manner. But at the same time, they can help you learn and focus. So I have a lot of people who will even just take a book and write in what they eat on the right, or use an app and put all that in there. But there's this false expectation that the information you put in there is truly accurate. The apple might not be the perfect size, and the data that are put into the app might not be perfectly correct. It might focus on net carbs when I'm using a total carb method. It might, at the end of the day, tell you you haven't reached your calorie goal. Have you ever seen that on an app? Like, no, ignore that. You haven't reached your fat and your protein goal. No. So I started using this app, and I got tired of it saying, how was your breakfast? Do you have an app that says, how was your breakfast? Well, I didn't have breakfast. So it got annoying, so I stopped using that app. Just eating when you're hungry, stopping when you're full goes a long way. Do I have to eat keto forever? Well, if I really get that deer in the head, I'll say, look, I'm teaching you a goal. Once you get there, it teaches you a method to get to a goal. Once you get there, you can reevaluate. And then, okay, or just do it till the next time. And even then, just do it one day. And, your hunger will be gone. And if that's true, then keep doing it. And then that's usually the bargain that will get people started. But once you're started, you really are finding this is a great way to live. Do I have to, or can I add carbs? No, ideally stay keto forever. And you can do it. The latest science is even suggesting that you may, like the mice in the research studies, live longer by not eating the carbohydrates. That's pretty impressive. But those studies aren't done in humans yet. But if you add carbs, still eat low carb, high fat, or keto. Again, the bottom line, don't have any form of sugar ever, or in very small amounts. This is the major take-home point of what I've learned anyway as a clinical researcher in nutrition. Some nuts and low glycemic fruits would be okay to bring in, some dairy, higher carb veggies like carrots and legumes, watch the amount. Some whole grains, but not bread, are kind of the guidance that we would give. If obesity or the disease like diabetes starts returning, of course, then you would cut the carbohydrates down. Probably the most common mistake I see is the rapid and massive reintroduction of carbohydrates, someone going from 20 a day to, say, 100 a day. To me, that's a huge increase. Now, if you talk to an average dietitian, they would say, well, that's still low carb. But so remember, I've been working in a world where people are eating about 20 carbs, maybe 30, and so for metabolically, your blood has 5 grams of glucose in it going around at any given time. If your blood glucose is normal, why would you ever want to introduce 100 grams of glucose? Well, if you like it, you're healthy, and your insulin goes up to bring it down, a lot of people choose to live that way. But just reintroduce carbs slowly, if you do, at all. So is keto safe and effective? Yes, a keto lifestyle is healthy and therapeutic for many chronic medical conditions, and the evidence from many scientific studies and decades of clinical practice surpasses what the FDA would require to approve a new drug. So basically, I'll say, if you follow this, it will work, just like a drug that's approved by FDA, the US FDA. And doctors, when they prescribe an antibiotic that's FDA approved, they know that it's going to work. So that, with the same confidence, this plan will work. That's what I tell people. So it gets away from the, well, is it really going to work? Or, well, then I say, but it will only work if you do it, right? So I prescribe, other doctors prescribe these large potassium pills. And, people come back and say, I just couldn't swallow that big pill. Well, the pill didn't work if you didn't swallow it, right? So the diet works if you do it. I can't make you do it. But that's a sticking point for a lot of people. They still are hung up on whether it works or not. But with the same confidence, and doctors are hung up on that. Just like drug approved by FDA. Individuals with diabetes, hypertension, heart failure, gout, or kidney stones might require special consideration and monitoring, thus the idea of a de-prescribing clinic, and you might add in different supplements or different types of monitoring for these sorts of conditions. Watch the vitamin K. If someone's on a Coumadin or anticoagulant drug, watch the sodium if someone has a history of heart failure or high blood pressure. I have this book in the office, or the 2 pages now. The book is fallen apart. We've known the cause and effect for over a century. And here in the Principles and Practice of Medicine from 1923, the 10-gram carbohydrate diet was prescribed to a 60-kilogram person, which was normal then, to treat diabetes. It was also used to treat obesity. Of course, in 1863, the century before, it was first described in England as a weight loss method too. So we lost the path. One might argue that the medication focus and the low-fat diet prominence got everyone off track, and so it still works today, thankfully. A couple take-home points, any diet can cause weight loss, and in the obesity medicine world, we see all different kinds of diets, and we see people after surgery and all that. So, and you'll hear that by some percolating through to doctors now who think they've learned that the best diet is the one you can stick to. Have you heard that? So it's kind of percolating into these guidelines, and well, not really. The best diet is actually the one that fits your metabolism best. So while you may lose weight on a low-fat diet, this is comparing the low-fat diets to the keto diet. The metabolic effects, remember, in terms of HDL going up here, metabolic syndrome is the triglyceride going down, which is a good thing, and the HDL going up, which is a good thing. The green bars are the keto diet. Lowering the carbohydrates works better, even though the weight loss is the same. So different diets actually can have different metabolic effects, and the keto one is very effective for metabolic syndrome, or more effective, and then also for getting people into remission for type 2 diabetes. This is just a graph that shows the amount of insulin. This patient A, for example, was on 500 units of insulin per day. Someone comes, I teach the class to the office, I teach the class, I say, are you going to do it? Let's count up all your insulin. Let's cut it in half on the first day if your blood sugars are sort of normal in the 100s, around 6 to 8 in metric units. And then this person is still on insulin, but he's paying much less, and he's a happy camper because he's not having to shoot up as much insulin. These patients, my record that isn't on this slide, though, is taking someone off 180 units of insulin in one day, because he didn't tell me, and who's going to tell the weight loss doctor that he was drinking 2 liters of a sugary beverage every day, and it basically was drinking the sugar and injecting the insulin. He was taught to not drink sugary beverages, and he no longer needed the insulin. So you may actually see this in the hospital. If you work in hospitals and you take someone and you make them fast or just take away the carbs, the blood sugar can come down dramatically. And if you don't reduce the insulin, you will have hypoglycemia or low blood sugars, and that can be life-threatening. So the medicine can become too strong very fast. And so that's another a warning that you want to do this with a doctor who understands, or health practitioner who understands how fast things can get better if you're on medications. But the keto benefits are much more than improved weight or blood glucose. You have weight, you have reduction of body fat, different metabolic effects, hypertriglyceridemia gets better, the high triglyceride in the blood better than any other diet. You might stay on this for your lifetime because you just feel better mood, your blood pressure goes down, inflammation goes down. There was a doctor who created a clinic, an orthopedic surgeon, a keto clinic next to his practice so he could operate more, get the weight down preoperatively, and then you have better outcomes after losing weight before the surgery. Well, he found that about 1/3 of the people who he was treating with a keto diet who were in line for the orthopedic surgery no longer needed the surgery after losing the weight, because of the weight loss and the inflammation. And I looked him in the eye and said, even if it's bone on bone, because I get people looking at me, it's bone on bone, doctor, and nothing's going to help this. And he said, yeah, even if it's bone on bone, doesn't matter what the X-ray shows. You're not going to operate on someone's knee unless they're having pain or loss of function. So that's pretty cool. So I do a lot of consultation with people preoperatively. The surgeons want to operate and get better outcomes. So even non-orthopedic surgery, abdominal hernias, other kinds of things, surgeons will send patients to me, and I use a keto diet. Pain, mobility, sleeping better. I would say most people continue this kind of lifestyle because it takes away the hunger, so you're not obsessing about what you're going to eat next, or people just feel better, have more energy, and those are very valid reasons to continue the lifestyle. Of course, the best evidence is how keto transforms lives. I became a almost, depressed internal medicine doctor, disillusioned. Why did I become a doctor? I'm just pushing medicines and giving insulin shots, and then you know what? Your patients die. Well, they're actually grateful that you care for them, but we can't fix that outcome yet. Now I'm a happy doctor who goes to work with people telling me that, I haven't biked in years, and now I'm back on my bike. Or now I'm doing this, I'm playing with my grandkids, I'm doing all these things. I didn't think I could go back to doing that. And so we give people hope, any kind of obesity medicine treatment, including using the keto diet. And that's really what makes this a gratifying kind of work to be in. And teaching other doctors how to do this is an exciting position for me to be in. So then they can help more and more people be able to do this. Now, watching the science, and we're observing different meetings now popping up. The meeting in Tampa for a couple of years will now be in LA, the Metabolic Therapeutics Conference, And then the Ohio State is putting on a conference. Jeff Volek, who's now there, will put on their first conference this fall. And what's really exciting is not only the new basic science that's being done on epilepsy, Alzheimer's, cancer, but also the world is changing by anecdotes and Facebook, with a recent publication of type 1 diabetes in the journal Pediatrics, which was a survey of type 1 GRIT Facebook members, which was pretty incredible that a medical journal took a Facebook survey, but it was supported by actually surveying the doctors of the patients, validating it as well. David Ludwig was the lead behind that at Harvard. So 4 people got up at a recent meeting in San Diego and said that their rare condition of McArdle's, a glycogen storage disease, got better by going keto. And this is a time-honored condition where you can't store sugar in the muscle, so feed the child sugar all day long because the muscle needs sugar, right? Well, so a generation of doctors trying to fix this never thought, why not change the muscle to a fat-burning type of cell? And so these people tried it on their own. Remember, that's what keto does behind the scenes, changes you from a sugar burner to a fat burner. And the muscle actually burns fat really well. And so we published a couple case studies, or a case series it's called, based on these people getting up in the front of the conference. We tracked them down, and now that's changing the medical research world by your experiences. And this really exciting to see groups of people get together, and when you're at a certain tipping point of number of people doing something, it's incumbent upon the academics to take a look and then put it in literature so other people can look at it as well. A little humor, I guess, is sort of ironic humor. There's some people who, I wish I had a device like this. Remember from the movies Men in Black, the device that erased the memory of the aliens that they just, were involved in. I really need a device that erases the memory of other diets and people have done in the past. And this medical student helped me come up with a prototype, because it is okay to eat, fat and eggs and all those things and have salt, even though people were taught that for so long. But you don't need a magic wand or reprogramming. It's just doing it over and over with the guidance at first. So if you're just getting started, what's step 1? What's getting in your way? Old habits applied to new diets. Yes, it's like driving on the left-hand side of the road. The rules are different. If you're, in England, in the UK, you don't want to drive on the right-hand side of the road like we do here in the US. You're discouraged to yet try another one. Just keep in mind that clinic of last resort. It's pretty amazing to me, even today, that some people will have said they tried everything. They even had the weight loss surgery, and they never tried a keto diet. It had been ostracized and thought to be so bad for so long, it really wasn't part of the tool chest. And still, having trouble getting the dietitians to come on board to read the science and to use it in their practices, although there are a growing number who are. Complicated, incorrect, or confusing programs, it doesn't have to be all that difficult. Carb addictions, you fight this, people blaming themselves for an addictive substance. You see that's part of addiction. The Oreo in the middle of the night that's not put in the MyFitnessPal, and then you wonder why it's not working. The person who is just kind of too ashamed to call out that they have a drinking problem on a Facebook group. But they come in, they talk to me, I go over all of this stuff in a supportive environment, can help with all those things. How your body, unfulfilled realistic expectations. The weight loss process with a keto diet is rarely a straight line down. It will have fits and starts and more like a stair-step pattern rather than a linear line down in terms of weight. You want to figure out how your body works and changes. And yes, you are different. I never thought I would be that kind of doctor who said, everyone's different, but Everyone's different. I can help normalize the expectations. In my clinical setting, I'll see 1 pound or 2 of weight loss per week. So that means 4 to 8 pounds per month, 50 to 100 pounds per year when you're absolutely strict. So just to give you a context for that. Side effects of medicines, weight loss doctors glow in taking away medicines that have side effects. He says, you'll feel better. And you'll think that I did something magic when actually I just took away metformin that was causing you diarrhea, you know? So deprescribing is a great philosophy there, taking away the medicines if you no longer need them. Stress, no doubt, and the onus or the feeling that I have to have grandma's pie, cooks, cakes, can't, you know, because food is love, and we help people through all those sorts of things. Or you have those things when you're on vacation, you take a holiday, not a holo week or a holo month. The obesity medicine clinic's pretty busy in the first part of January, as you might surmise, as people get back on track. That's okay. The social pressure, of course, you just learn to deal with that over time, or think of yourself as a leader, as a trendsetter. The lifelong success is not about learning what to eat, but focusing on the goal. So the HEALcare 4 simple guidelines that we like to focus on are changing your focus. Number 1, think of it as a lifetime thing. A short-term goal, short-term success is not what this is about. It's not a yo-yo diet where you do it and then you get back off it and it all comes back. Find your own measures of successes, and it's more broad than just using the weight on the scale. Biomarkers are great, just how you feel are great markers. Learn what works for you and don't compare yourself to others. And then keeping it simple, as I tried to outline here, it's okay to have the best source of protein that you can afford. You don't have to be totally militant about the types of oils. For a lot of people, the straw that breaks the camel's back is that little thing that, I noticed that the burger wasn't grass-fed, so I just ate the bun. I can't make that up. How to get started on your lifetime of keto? Well, if at least one of these applies to you, you're on insulin, blood glucose medicine, you have high blood pressure, your BMI is over 50, then seek a medical provider who knows the keto approach. And HEALcare is designed to provide that. Otherwise, you have 2 options. You can do a guided program with trained coaches. There are many of them online, including the HEAL clinics. Or you can do it yourself. But you must learn what's factual and be very self-motivated. There's lots of misinformation out there, and I just wanted to kind of dispel all of the confusion that I've seen about how difficult it has to be, and it doesn't have to be that way. It doesn't have to be difficult. So HEALcare, again, is for those who can't do it by themselves. It's providing ongoing personalized support and guidance. There's real face-to-face visits if you need them to get off medication. There's one-on-one partnering either by phone or email or Skype, FaceTime. Commitment coaching is a weekly program where you're with other people doing the same thing you are, facilitated by trained coaches. We set up if you want some background on the science, a lot of this information is put into a free Power of Low Carb kit, which is downloadable at the HEAL Clinic's website. And I thank you very much for your attention.